there! I want to thank you for watching this video. My name is Jessica and I'll be talking a little bit about fluoride today. Typically when I'm talking with students, what I like to do is I like to read it in a book or textbook or on the screen like overhead and kind of go over what the textbooks are saying word for verbatim. And then I like to kind of show pictures, you know, tooth models, things like that, to kind of get the image, the idea of the words that we read into an image form. And then I like to do an actual physical hands-on portion if it works out with the text that we're studying. So for now, we're going to talk a little bit, just briefly, because at this point we would have already discussed what was in our textbook, briefly about fluoride, the various forms of fluoride that we use every day, the fluorides that we use in a dental office. So there's a few different fluorides, obviously. We have fluoride in our water. That's the intrinsic fluoride that we drink, and that is going to help to mineralize our bones and things inside of our body from the inside out. That's the way I like to think of fluoride in water. The fluoride varnishes and gels and foams that we use in a dental office are more of the topical form, so they're going to be placed on the tooth surface and absorbed from the outside end of just the tooth. What are some reasons we would want to use fluoride? Most importantly is preventative care. We want to prevent problems from occurring at all. Secondary reason would be anyone with moderate to high risk caries, somebody who's just prone to getting cavities or has in the past, or maybe didn't have that intrinsic water fluoride previously. That's going to be an important reason why we would do a topical fluoride. We also use it a lot for treatment of hypersensitivity, particularly to temperature. We see this in the hygiene realm a little bit more with scaling and root planing. We'll a lot of times do a fluoride treatment following their perio treatments, simply because those root surfaces have been disrupted. Things are more sensitive than normal. It's going to help with that. Another reason would be for a cavity liner. Now that's something that a dental assistant is going to see more of based off of what their doctor's preference is, but it's awesome to use as a cavity liner because it's releasing those fluoride ions within the tooth after it's been prepared for the filling. So one thing we would want to talk about are the forms of fluoride. The gel, like I said, the gels and foams are the older versions. Probably the oldest version of topical fluoride in a dental office would have been the rinse, that nasty rinse we all had to use when we were younger. A lot of times the schools will use the rinse back in the day. Now we're using what's more commonly known as the varnish, which is what I'm going to kind of show you as far as a demonstration.